The first step is our provider will prep the patient with betadine to sterilize the area, as well as alcohol. The next step is the ultrasound will be placed on the medial area of the buttocks externally to help guide the placement of the needle for the treatment procedure. So the provider is treating the posterior femoral cutaneous nerve as it wraps around the medial buttock. And you can see on the ultrasound, you have the bone is highlighted white. And from the top left of the screen, you will see the direct treatment where the posterior femoral cutaneous nerve is and opening up the fascia along the area where the nerve flows to create space, increase blood flow, and decrease inflammation. So that is complete. The second treatment will be on the posterior aspect, also the medial buttock. And this will be the pudendal nerve, as well as one of the muscles of the pelvic floor will also be trigger pointed. Today, our provider will be treating the iliococcygeus. And prior to the second treatment, our provider is prepping with betadine and alcohol. So our provider is changing the settings on our ultrasound machine and adding the color Doppler for visualization of the fluid and the blood flow. And the ultrasound probe is placed again externally on the medial buttocks in alignment with the pudendal nerve this time, as well as the iliococcygeus muscle of the levator ani or pelvic floor. Cold numbing spray again is used to numb the skin. And a needle will be placed this time. If you look at the ultrasound machine, the top left again, you see the needle's tiny tip coming in and creating space along where the pudendal nerve flows at Alcock's canal, releasing the restriction with high volume and increasing blood flow to this area and decreasing inflammation, as well as resetting those hyperactive peripheral nerves that come with pelvic pain. On her way out, she's going to trigger point the iliococcygeus, one of the major muscles of the pelvic floor, the levator ani. And that's it.